Most people believe diabetes only shows up when a lab report tells you. You go in for a routine checkup, you feel completely fine, maybe just a little tired sometimes. The doctor looks at your results, pauses for a second, and then says a word that changes everything. You have diabetes. And in that moment, your mind starts racing. How long has this been happening? How did I not notice? Was my body trying to tell me something and I missed it? I understand why so many people think this way, because for years, that's exactly what I heard from my own patients. Good people, careful people, people who thought they were doing everything right. And yet, they were completely blindsided by their diagnosis. But here's the truth that almost no one talks about. Your body doesn't stay silent. It doesn't wait for a blood test. It doesn't suddenly develop diabetes overnight. Your body starts warning you, quietly, subtly, sometimes years before any doctor ever confirms it. The problem is, those warnings don't look dangerous. They don't feel urgent. And because of that, they're almost always ignored. And one of the very first places your body begins to speak, your feet. Now I know that might sound surprising, because when something feels off in your feet, most people don't think twice about it. They say things like, I'm just getting older. I was on my feet too long today. Maybe I slept in a weird position. And then they move on. But let me ask you something. What if those small, everyday sensations, the slight tingling, the occasional numbness, that strange burning feeling at night, aren't random at all? What if they are actually early warning signals, your body's way of saying something is not right? Because here's what's really happening behind the scenes. When blood sugar levels stay elevated for too long, even slightly higher than normal, it starts affecting your nerves, slowly, silently, almost invisibly. The tiny nerve endings in your feet, the ones responsible for sensation, are often the first to be affected. Think of them like electrical wires. When everything is healthy, signals travel smoothly, but when sugar levels remain high, it begins to damage the protective layer around those nerves. And over time, those signals become distorted. That's when you start feeling things that don't make sense, tingling without a reason, numbness that comes and goes, burning when nothing is actually hot. And because this process is slow, most people don't recognize it as a problem. They adapt to it, they ignore it, until one day it's no longer something small. The reason I'm making this video today is because I've seen this exact pattern again and again. People walking into clinics, or worse, emergency rooms, with complications that could have been prevented, not because the signs weren't there, but because no one ever explained what those signs meant. Let me share something that really stayed with me. Recently, I spoke with a 68-year-old man, retired, disciplined, lived a simple, healthy life. He told me, "Doctor, I don't understand. I've never had any major symptoms. I felt fine." But as we talked more, he casually mentioned something. He said, "Sometimes when I'm watching TV at night, my feet feel like they're buzzing, like a light vibration. It's been happening for a while, but I thought it was nothing." Nothing, that's the word he used. But it wasn't nothing. That buzzing sensation was one of the earliest signs of nerve damage. A sign that had been there, quietly progressing for months, maybe even years. When we checked his blood sugar, it was already in the diabetic range. And in that moment, you could see it on his face. Not fear, not shock, but regret. Regret that he didn't know sooner. Regret that he didn't understand what his body was trying to tell him. And that's exactly why this video matters, because chances are, if you're watching this right now, you felt at least one of these signs. Maybe you ignored it. Maybe you explained it away. Maybe you told yourself it's just part of aging. But what if it's not? Today, I'm going to walk you through 9 warning signs that often appear in your feet long before diabetes is officially diagnosed. And for each one, I'll show you what most people think it is, what's actually happening inside your body, and one simple, practical step you can start today to protect yourself. Because right now, there are millions of people living with elevated blood sugar, completely unaware. No diagnosis, no treatment, no action, just silent damage, affecting their nerves, their circulation, their vision, their kidneys, and yes, their feet. But here's the part most people don't hear enough. If you catch these signs early, you don't just manage the condition, you can slow it down, you can control it, and in many cases, you can prevent serious complications altogether. But that only happens when you stop ignoring the signals, when you start paying attention, when you finally understand what your body has been trying to tell you all along. So before you dismiss that next tingling sensation, before you ignore that burning feeling tonight, let's make sure you know exactly what to look for. Let's start with the first sign, the one almost everyone has experienced and almost everyone gets wrong. Just small signs, easy to ignore, easy to explain away. And by the time most people finally take them seriously, the damage has already begun. I've seen this happen again and again. Patients walk into the clinic and say, "Doctor, I wish I had paid attention earlier." Because the truth is, diabetes doesn't usually arrive suddenly. It builds, silently, over years. And your feet, yes, your feet are often the first place it shows up. Let me explain. One of the earliest signs almost everyone experiences is that strange tingling in your feet, that pins and needles feeling or numbness that comes and goes. Most people laugh it off. They say, "My foot just fell asleep." And sometimes that's all it is. But when it starts happening more often without any clear reason, that's when it becomes something else entirely. In medical terms, this is called peripheral neuropathy, and it's one of the most common early complications of elevated blood sugar. According to data supported by organizations like the American Diabetes Association, nearly half of people living with diabetes will develop some form of nerve damage. But here's what most people don't realize. This damage doesn't start after diagnosis. It often begins years before. Excess sugar in your bloodstream slowly begins to damage the tiny blood vessels that supply your nerves. Without proper blood flow, those nerves don't get enough oxygen and nutrients. Now, imagine your nerves like electrical wires. Each one has a protective coating that allows signals to travel smoothly from your brain to your feet. But when blood sugar stays high over time, it slowly wears down that protective layer. The signal doesn't stop completely, it just becomes distorted. And that distortion is the tingling you feel. At first, it's occasional, easy to ignore. But over time, it becomes more frequent. And that's your body asking for help, long before anything shows up on a lab report. Now, here's where it gets even more interesting and more concerning. Many patients tell me their symptoms don't really bother them during the day. It's at night, when everything becomes quiet, that things start to feel different. They lie down, trying to sleep, and suddenly their feet feel like they're burning. Not warm, not uncomfortable, burning, like heat is radiating from inside their skin. And they don't understand why, because nothing is actually touching their feet. No heat source, no injury, but the sensation is real. This is another classic early sign of nerve damage. When nerves are injured by prolonged high blood sugar, they don't just lose function, they start sending incorrect signals. Your brain receives a message that something is hot, even though nothing is. It's like a fire alarm going off in a building that isn't on fire. The system is still active, but it's no longer accurate. Research published in the journal Diabetes Care has shown that symptoms like burning foot pain can appear 1 to 3 years before a formal diagnosis of type 2 diabetes, which means for many people, the warning signs are already there. They're just not being recognized. And what makes this even more serious is what happens next when things are still ignored. Because eventually, it stops being about discomfort. It becomes about risk. I remember a patient who came in and said, "Doctor, I had a small blister from my shoe. It's been weeks." That's when you know something is wrong. because in a healthy body, small cuts and blisters heal quickly. But when blood sugar remains elevated, healing slows down dramatically. This is because high glucose levels damage your blood vessels, especially the tiny ones in your feet. Those vessels become narrow, stiff, less efficient. So even though your blood is carrying oxygen, nutrients, and immune cells, they simply can't reach the wound fast enough. The body has everything it needs to heal, but the delivery system is failing. And that's when a small, harmless blister can turn into something much more serious. Data referenced by the Centers for Disease Control and Prevention shows that diabetic foot complications are one of the leading causes of non-traumatic lower limb amputations. And in most cases, it started with something small, something ignored. But the body doesn't just show signs through pain or wounds. Sometimes it shows you something you can actually see, a change in skin color. Around the ankles or the feet, you might notice darker patches, redness, or even a slightly bluish tone. Most people assume it's just skin variation, maybe sun exposure, maybe aging. But in some cases, it's a sign of reduced circulation. When blood flow is compromised, your feet, being the farthest point from your heart, don't receive fresh, oxygen-rich blood, and your skin reacts. It changes color. It may become thinner, more fragile. This is your body's way of signaling that something deeper is wrong. Studies published in journals like the Journal of the American Academy of Dermatology have noted that these subtle skin changes can appear well before a formal diabetes diagnosis. And then, there's one final sign, the one most people completely dismiss: cracked heels, dry skin that just won't go away. People say it's normal, it happens every year. And yes, sometimes it does. But when those cracks become deep, persistent, and resistant to every lotion you try, that's a different story. Because this isn't just about dry skin. This is about nerve damage affecting the autonomic system, the part of your nervous system that controls things like sweating. When those nerves are damaged, your sweat glands stop working properly. Your feet lose moisture from the inside out. So no matter how much cream you apply, you're only treating the surface. Meanwhile, the underlying issue continues. And those cracks, they're not just cosmetic. They're open doors for infection, especially dangerous when circulation is already compromised. Organizations like the American Podiatric Medical Association highlight chronic, hard-to-heal heel cracking as a potential sign of deeper nerve dysfunction linked to long-term elevated blood sugar. So now, I want to ask you something. Honestly, as you were listening to this, did any of these signs feel familiar? That tingling, that burning at night, a wound that took too long to heal, skin changes you never questioned, or cracks in your heels that just won't improve. Because if even one of these is happening, your body may already be trying to tell you something. And the earlier you listen, the more you can protect yourself from what comes next. Don't wait for a diagnosis to take your health seriously, because by then, the story has already been unfolding for years. And if this opened your eyes even a little, take a second and share it with someone who might need it. Sometimes, awareness is the first step that changes everything.
Here's something most people don't expect. By the time your feet start showing certain signs, it's no longer just about your feet. It's about what's happening deeper inside your body, especially your kidneys. Let me explain. A lot of patients tell me, "Doctor, my feet swell because I sit all day, or I'm on my feet too much." And they're not wrong. Occasional swelling can be completely normal. But there's a difference between occasional and consistent. If your feet and ankles are swollen almost every evening, if your socks leave deep marks on your skin, if pressing your finger into your ankle leaves a dent that stays there, that's not something to brush off. That's called edema. And it's often one of the earliest visible signs that your body's filtration system is under stress. Your kidneys are responsible for filtering every drop of blood in your body. Organizations like the National Kidney Foundation explain that when blood sugar remains high for years, it damages the tiny filtering units inside your kidneys. And when those filters stop working properly, fluid begins to build up. Now gravity takes over. That fluid settles in the lowest part of your body, your feet and ankles. What makes this serious is that diabetic kidney disease affects roughly 1 in 3 adults with diabetes, and swelling in the lower legs is often one of the first visible clues. Think of it like this. Your body is trying to drain excess fluid, but the drainage system is partially blocked, so everything backs up, and your feet become the collection point. Now here's what most people do wrong. They ignore it. Or worse, they reduce their water intake thinking it will help. But dehydration can actually make things worse. Instead, small changes can make a real difference. Elevating your feet slightly when resting helps fluid move back toward your core. Reducing excess salt intake prevents your body from holding on to more water than it needs. But most importantly, if that swelling is new, persistent, or getting worse, don't wait, because this is not just about comfort. This is about organ function.
Now, the next sign. This is the one I see misdiagnosed more than almost anything else, especially in men. And by the time they realize what's really going on, they've already spent months, sometimes years, treating the wrong problem. They come in and tell me, I've been taking painkillers every day. I thought it was arthritis. And sometimes it is. But sometimes it's not even close. Because nerve damage from high blood sugar doesn't always cause numbness. Sometimes it does the opposite. It creates pain. Sharp, stabbing, electric, burning pain. Pain that seems to come out of nowhere. Pain that gets worse at night when everything is quiet. And here's why. When nerves are damaged, they don't just stop working. They become unstable. They start firing random signals to your brain, signals that don't match reality. Your brain interprets those signals as pain, even though there's no injury. It's like a car alarm going off in the middle of the night. No one is touching the car, but the alarm keeps screaming. That's exactly what a damaged nerve does. The pain is real, but the source is internal. Research published in the New England Journal of Medicine shows that painful diabetic nerve damage affects around 1/4 of people with diabetes, and very often it's mistaken for joint problems or aging, which leads to one dangerous habit, masking the pain. Painkillers might dull the sensation, but they don't fix the cause, and when you silence a warning signal, you also delay the solution.
Now here's where things start to tell us how far the condition has progressed. Because some signs don't just suggest a problem, they reveal the extent of it. I'm talking about something many people joke about. Cold feet. Patients laugh and say, "Doctor, I've had cold feet my whole life." And sometimes that's true. But I always ask one question. Are your feet cold even in warm weather? Are they cold under blankets when the rest of your body feels fine? Because that's different. That's not temperature. That's circulation. When blood vessels become narrow or stiff due to prolonged high blood sugar, warm blood can't reach the farthest parts of your body effectively. Your feet are the last stop in your circulation system, and if the pathway is restricted, they're the first to feel it. Organizations like the American Heart Association report that conditions like peripheral artery disease affect millions of people, with diabetes being one of the strongest risk factors. And one of the earliest signs? Persistently cold feet. This is not about comfort anymore. This is about blood flow. And now, I'm going to share something that almost nobody talks about. In fact, most people don't even notice it until it's pointed out. But once you see it, you won't be able to ignore it. During foot exams, I often notice something subtle. The hair on the lower legs or the tops of the feet is missing. Not shaved. Not trimmed, just gone. And when I point it out, patients usually say, "I never noticed that." And that's exactly the issue. Hair follicles depend on a steady supply of oxygen and nutrients. When circulation is compromised over time, those follicles stop receiving what they need, and slowly they stop producing hair. It doesn't happen overnight. It happens gradually, quietly, over years, like plants in a garden losing water supply. They don't die instantly. They just stop growing. Research published in Diabetes, Obesity, and Metabolism has shown a strong connection between hair loss in the lower legs and vascular damage in people with diabetes. It's one of the simplest signs, but also one of the most overlooked. Now pause for a moment. We've talked about multiple signs across both parts. Not one, not two,
but several ways your body tries to warn you long before a diagnosis. And I want to be honest with you. One of the hardest moments in my work is when someone sits across from me and says, "I had all of this, and I didn't know." Not because they didn't care, but because no one connected the dots for them. You have that information now, and that changes everything. So here's what I want you to do. Tonight, before you go to bed, take 30 seconds. Just 30 seconds. Sit down and look at your feet. Not casually, carefully. Check the skin, look between the toes, notice any color change, any swelling, any cracks, any numbness. Because those 30 seconds could save you years of complications. And if you notice even one sign, don't delay it. Act on it. Because the earlier you respond, the more control you keep. And before you leave, I want you to do something simple. Go to the comments and type the number of signs you noticed. Just the number, nothing else. Because I read those comments, and it helps me understand what you're going through. And if this video helped you see something you hadn't noticed before, share it with someone close to you. A parent, a sibling, a friend. Because sometimes people don't need more time. They just need the right information at the right moment. And this might be that moment.